The Islamic Development Bank is promoting comprehensive human development in marginalized communities around the world. In Malawi, the Islamic Development Bank is supporting inclusive quality education for disadvantaged children as a means of increasing their opportunities to break out of the vicious cycle of poverty. Malawi has a population of 17 million people and is one of the poorest countries in the world, with 50% of its population living below the poverty line and 25% living in extreme poverty. Most children living in rural communities face huge barriers to accessing a quality education. They have to walk long distances of up to 15 kilometers to reach their nearest schools. Walking long distances exposes young girls to sexual harassment and HIV infection, as well as unplanned pregnancies. The schools they attend are in deplorable conditions with run-down structures, overcrowded and lacking basic resources and well-trained teachers. Some children access education in makeshift structures made up of grass. Children learning in such horrible conditions do not fully acquire basic skills and will reach their adolescent years without being able to read or write. This deprives them of opportunities to develop their full potential and escape poverty. Access to safe and potable water is another challenge which puts children and teachers at high risk of waterborne diseases. Most schools are below capacity, and with high enrollment, lessons are conducted outside under the shade of trees. Accessing education under a tree is unsustainable and makes both learning and teaching very challenging. When it is cold, children are affected, and when it rains, lessons are completely disrupted. These hostile learning conditions result in many children, especially girls, dropping out of school and going into early marriages, while those who remain in class do not fully acquire the necessary skills. Realizing the crucial role that education plays in breaking the cycle of generational poverty, the Islamic Development Bank has been funding construction of modern primary and secondary school infrastructure in some of the poorest rural communities of Malawi. The school construction projects are implemented by local civil society organizations. They identify deprived areas and engage both government and the local community to ensure sustainability. The schools are strategically built in more centralized places so that all children from targeted villages do not have to walk long distances. Working in collaboration with strategic partners, the Islamic Development Bank finances a charity organization to construct and maintain the school infrastructure. The community provides the land on which the infrastructure is to be built. Once the school construction is completed, the government provides teachers, educational materials, and textbooks. Other relief organizations introduce school feeding programs to keep the children in school. This collaboration is working well and helping to sustain the schools. Vulnerable children from poor households are being provided an opportunity to access education in a well-equipped school with high-quality infrastructure. This school's project is giving marginalized children a more prosperous and healthy future and helping their entire communities beat poverty and inequality.
Every nation that has succeeded, it has succeeded because its education is solid, and therefore for education to be solid, we need more and more partners to come in and support us. As a country, we are happy that the Islamic Development Bank has come in to support us by building a number of schools in the rural areas.
Thank you, Islamic Development Bank. You have built us a school. Thank you. Jazakallah, Islamic Development Bank.
Another barrier to accessing quality education in rural communities is shortage of well-trained teachers. Without enough trained teachers in the classrooms, an inclusive quality education will remain a distant dream for thousands of deprived children. The Islamic Development Bank has supported efforts to address teacher shortages by funding the expansion of Mariam Girls Teachers Training College. The college provides quality training for female teachers and is run by Al Baraka Trust, a local charity organization. The IsDB supported the expansion of the college by funding the construction of a hostel, additional lecture theaters, classroom blocks, as well as a science laboratory. This support has seen an increase in the enrollment of students.
The blocks that Islamic Development Bank has given to Mariam Teacher Training College have improved a number of things, especially space. We used to take 176 maximum because of the bed space we had at that time. The additional block, one of them has been used as a hostel. Now we can take 250. The classrooms too are spacious, more spacious than the ones we had before. They are spacious enough for group work and movement around the classrooms. And that is nice for them to practice what they are going to do with the learners in the primary schools.
By the end of 2018, the college had graduated over 1,700 new teachers. The new teachers have been absorbed into the government system and posted to different schools in all parts of Malawi.
Education, to be complete, teachers are very critical because you can have the textbooks, you can have everything that is there, but as far as you have no teacher to deliver, that would be a challenge. And we as government, we applaud the Islamic Development Bank for supporting us in the area of teacher education, because we know that the more we have the teachers, the more we are assured that we will have education and that these people will be able to impart that knowledge to our learners out there.
The Islamic Development Bank has also supported the health sector by funding the construction of 3 healthcare facilities in different rural setups. Many rural areas in Malawi lack proper health facilities, and communities have to walk up to 30 kilometers to access basic health services. But the construction of these health centers have enabled the local people to have easy access to basic health services, which includes treatment for malaria, cholera, and TB. The health centers are serving a combined rural population of about 22,000 households. The Islamic Development Bank is working towards improving health coverage and quality of health care for marginalized communities. This is in support of the Sustainable Development Goal of ensuring healthy lives and promoting well-being for all.
I just want to thank the Islamic Development Bank, which gave us this building, the maternity and the OPD. Before this maternity was opened, people used to travel long distances to find a health facility, and as a result, there were home deliveries, as well as some people could deliver before they could get their health facility. So this has reduced the maternal and neonatal mortality rate, as we are helping mothers of this catchment area.
The Islamic Development Bank has also supported the human resource development of Malawi by offering scholarships to Malawian students to study medicine, engineering, and other disciplines in OIC countries.
The IDB scholarships, when it came in, at a time when our community, the Muslim community, there was not even one trained Muslim doctor in Malawi. Some of the students trained by the IDB, they are now serving in the hospitals, treating patients in the hospital.
The Islamic Development Bank has adopted an inclusive, integrated approach to improve the socio-economic situations of rural communities in Malawi. From construction of school and health infrastructure to offering scholarships to students, these interventions are transforming the lives of thousands of disadvantaged households. This holistic approach has direct benefits for the achievement of inclusive growth and increasing productive capacity of the country.